And welcome to the show. I am Bill Knapik, sitting in for Kevin Price. And thank you, Mr. Price, for this great opportunity to talk to such great guests today. And this is the show where we talk about you and your business, the price of business. I am Bill Knapik, that's right. And I host 2 radio shows on Saturday. You can hear me on Real Estate Matters with Stuart Title at 1 p.m. on 100.7 FM and Successful Living with Bill Knapik at 10:30. And now, the price of business. I do want to tell you that portions of this show are sponsored by Cornerstone Business Coaching. And now, our first guest is Mr. Rob Bartlett, Jr. He is with Direct Care Partners. Rob, thank you, and welcome to the show.
Thank you. Thank you very much.
It's always exciting. Now, Rob, tell everyone about your company, Direct Care Partners.
So our company is a new venture, relatively new, in a niche of primary care services, which when you go to the doctor to get your checkup, you get your wellness screenings, that's primary care.
That's right.
So we're in a small niche called direct primary care, where primary care physicians are decoupling their services from insurance, and they're going direct to the patient and essentially offering their services for a monthly membership fee.
Now, let's hit that term again, decoupling. That's not one that we hear a lot. I think of a railroad car where we're taking the cars apart. But let's hit that, if you would, please. Decoupling, the physician decouples from the insurance company.
So there's a particular business model that's been well tried and true for at least 20 years called concierge. And in concierge, what those doctors did starting back in the 1990s is they set up concierge services where they charge an entrance fee. $100, $150, $200 a month, that's the going rate for concierge. And they continue to bill insurance, but what that membership fee did was it allowed them to provide additional services over and above what they could do for what the insurance reimbursement would be for their primary care services. With direct primary care, we went one step farther, and we said, look, we're gonna completely decouple from insurance. We're not going to bill insurance for anything, and all we're going to do is charge a monthly membership fee per patient, and that's the sum total of all compensation. So that's the subtle distinction between concierge and direct primary care.
And I also like your motto on your business card. It says it's about care, not coverage. And for any individual these days, all we hear is the term coverage and deductibles, and we really lose sight of the fact that when we need a physician, whether it's for a checkup or a situation, we kind of forget about the care because the first thing they say, let's see your insurance card.
That's exactly right. Exactly right. So some portion of the membership, the patient members for many of the docs across the country, I would guesstimate about 2,000 doctors in probably at least 40 states are applying this model right now today. And some portion of the patient members for most of those docs, they have no insurance. So you can get in to see the doctor if you can afford the monthly fee, or if your employer can afford to pay it for you. You can get in today, tomorrow, as much as you want, as often as you want, unhurried, extended time visits. And because they don't have to present a bill to get paid, and the doctor doesn't have to see you face to face, they can communicate by text and email and phone.
Now, you say the word unhurried. I remember trips to my doctor. I'm ready for my annual physical, but when I have the physical, it's usually a hurried up situation. They only have so much time, and you always feel like you're in the doctor's in a hurry because he goes from one room to the next, or she goes from one room to the next. So you're getting better service in this model. Well,
Bill, you're hitting the nail on the head. Insuring primary care is like insuring your tire rotations and oil changes. Adding the infrastructure and the overhead of insurance on top of simple primary care visits is a big factor in driving up the costs, which in turn means the doctor has to see 20, 30 patients a day in order to get enough reimbursement to keep his doors open. In direct primary care, because all of the physician compensation is through the membership, they can afford to spend a half an hour, 45 minutes, or an hour, or as long as it takes for every single visit.
So in this case, is this doctor that's in the direct primary care also doing the normal traditional insurance for with an employer in addition to doing direct primary care, or has he or she totally decoupled from that?
Well, see,
model?
that is actually a great question, because there are a good many doctors who have begun to accept memberships but keep their insurance billing going during the transitional time period. So that is a perfectly viable alternative for the doc. Employers, however, are beginning to think about what we call care first benefits, which means the employer will pay the part or all of that membership fee for the employee and then provide additional insurance as part of an overall group health plan if they can. Smaller employers provide no insurance. We have in our model, we have employers right now just buying or paying for the monthly membership fee for their people, their employees, and not providing insurance because they're less than 50, they're too small, and they can't afford it. So employers can actually get in this game and support the membership and then either add on some additional insurance coverages in their group health plan or not.
So it sounds like the advantages as you go forth to make this advantageous for all concerned, you're hitting the 3 points. You're hitting the advantages for the individual in which they'll get better care, more time, where they can actually sit and talk to a doctor. Number 2, you're addressing the physician's needs and maybe bringing it back to the times gone by where the physician actually acts like he cares more or she cares more, and then also the employer's involved. So those are a lot of things to wrangle together. How does your company do this?
Well, so our pilot project in Lawton, Oklahoma, will be working with physicians in Houston in the near future. But my good friend from high school, Dr. Brian Birdwell, is an internist in Lawton, Oklahoma. He and I have been working to put this model together for about 3 or 4 years. And what we have done in Lawton is, to begin with, he began offering memberships in conjunction with insurance and then gradually phased out of his insurance contracts. Now he's 100% membership. His life is much more satisfying, so that takes care of the second leg of the three-legged stool. He is much more satisfied, much happier practicing medicine in this situation. Thirdly, we've begun to go to employers and say, look, here is a care-first approach to employee benefits. Support the membership in the clinic for your people, and then consider what other insurance products you might be able to afford to make available to them. So we've actually gone now, as you might imagine, some of his patients also own businesses. Mm-hmm. So those have been the first employers that we've gone to. We signed up. We became revenue positive in January. We signed up with the first employer. We have 2 employee meetings this coming Friday in Lawton, and then a wide variety of other prospects. We will begin a direct mail campaign in the near future, and that's how we'll get the word out. We're working through the Chamber of Commerce and the local newspaper to provide educational forums, brown bag lunches, lunch and learns, and that sort of thing for employers. So that's how it's unfolding.
Let's tell people about the website, Rob, so that they can check this out as we're talking.
Sure. So our website is directcarepartners.com. And my partner, Dr. Birdwell, his own clinic website is mainstreetdpc.com. The DPC stands for Direct Primary Care.
And again, directcarepartners.com. And Rob, in fact, it reminds me of a conversation I had with a doctor, and I think she's in her low 50s, and she left being a physician to be in another profession that's using her credentials as a physician. However, she was so turned off and hassled by the insurance. She says, what I went in for to begin with, I no longer want to do. I mean, do other physicians echo that sentiment?
Well, there's been a depletion of primary care physicians. 30 years ago, 50% of all doctors coming out of med school went into primary care. Today, it's closer to 30%, and it's a downward curve. So the dissatisfaction among primary care physicians, family medicine, internists, and the like, has reached epic proportions. This type of model that can revitalize and restore the patient relationship and the satisfaction of the doctor is the best chance we have of saving primary care.
So your model is here just in time. Thank you, Rob Bartlett Jr. Rob, tell people once again the website, how they can learn more.
Our company is Direct Care Partners, and our website is directcarepartners.com.
Thank you, Rob Bartlett Jr. In the meantime, you're listening to The Price of Business. Your host today, Bill Knapik. Stay tuned. We're coming back with even more.